Are you suffering from chronic debilitating pain? Are you not golfing anymore? Are you not being able to play with your grandkids anymore? Are you not doing normal chores around your house because pain has you sidelined? Hi, I'm Dr. Mark Morningstar of the Natural Wellness and Pain Relief Centers. As a certified MUA physician, I can tell you that there's a procedure out there known as manipulation under anesthesia, or MUA, that has the potential to give you your life back, sometimes in as little as 3 days. So if you're somebody who is suffering from chronic debilitating pain, whether it's back or neck pain, fibromyalgia symptoms, maybe you've already had a back surgery and are maybe facing a second surgery. If you are somebody who has already tried spinal injections or epidural injections, somebody who's been to physical therapy for an extended period of time, maybe you've already been to the chiropractor, MUA may be right for you. What you are about to see on this video is an introduction to the manipulation under anesthesia procedure, or MUA. This video will explain to you what is manipulation under anesthesia, what the procedure entails, how often the procedure is administered, and what you can expect before, during, and after the MUA procedure, both here in the surgery center and in our clinic afterwards. So please sit back, relax, and I hope you enjoy this information and take it in because it could change your life.
Before I was hurt, I was like super active and work out every day and play sports. Since then, I haven't been able to do any of that. Anything, because it's like 24-hour pain. So, well, I feel like I did everything already besides surgery. I did the pain injections, physical therapy, manipulation,
like
everything else.
Right.
Yeah.
Sure.
And so I really feel too young to be having surgery already, especially when you usually have to go back and have it done more than once. So I was up to try whatever to fix my back.
How have the effects of those surgeries impacted your normal daily activities?
Oh, it's changed me completely. I mean, I was extremely active, and you know, it got to where I played a lot of basketball, I played softball, I golfed. I had to give it all up. I just like to wake up in the morning without back pain.
Okay.
You know what I mean? I mean,
yeah.
it's just, you know, I got to learn what chronic pain meant.
Well, actually, MUA, most people don't realize, is a procedure that's over 90 years old. It was started in the 1920s by osteopathic medical physicians and was primarily done, and still is today, for disc herniations. MUA stands for manipulation under anesthesia. It's had decades of good quality research on it, so they know it has a very proven, excellent track record for getting pain relief in a pretty dramatic fashion for people who have literally tried everything else. In order to be a candidate for MUA, people definitely have to have tried at least one, for us preferably a couple of other types of treatments, whether that's chiropractic care, physical therapy, steroid injections, or maybe an epidural injection, and none of those treatments got them a significant improvement. Maybe a combination of those treatments or any one of those treatments might have gotten them 20, 30, 40% better, but just wasn't enough to get them back to, you know, their regular daily life and back to the things they love to do. And with MUA has a track record wherein we do the actual procedure here in the surgery center for 3 days in a row, and then for 6 to 8 weeks afterwards they come into our clinic for follow-up physical therapy and rehabilitation. And over the course of that entire protocol, after the 6 to 8 weeks is complete, most people are anywhere from 60 to 85% better, and that's what all of the literature on MUA has shown on a consistent basis. We've gotten people back to work within 90 days following the procedure. In fact, in a study done in 1999 by a colleague of mine, they performed MUA on 188 patients, and all of these patients were out of work on disability. And 6 months after the MUA was complete, almost 2/3 of all of those patients were back to work on full duty. And that's a highly successful number compared to what most pain management clinics get, what most chiropractic offices get, and even regular physical therapy offices get. And most of those people who are also back to work either have completely eliminated or significantly reduced the amount of, whether it's prescription or pain medication, that they had to take. So it's a procedure that literally in a very, very short period of time can turn around somebody's quality of life.
MUA is a wonderful procedure that helps people get out of pain. People have been involved in an auto accident, various types of injuries, even fusion surgeries, and they can't get the relief that they're really looking for. MUA can be that answer that they're looking for. In an auto accident, I would say let's try therapy first and go through a reasonable course of therapy, go through strengthening therapy. However, with auto accidents, a lot of times patients make the mistake of not seeing a doctor right away, and they'll wait. The problem with that being is that scar tissue can begin to form in the spine within 48 hours of that injury, because it alters the mechanics of the spine so much that those tissues will begin to form scar tissue very, very rapidly. And if you don't see a proper doctor for that in that period of time, then that scar tissue will begin to form and those adhesions will begin to form. So a lot of times patients who've been involved in auto accidents won't see a doctor till a week later, 2 weeks later, or sometimes even months later. And the problem with that is their spine is in a much worse position because those whole degenerative processes and scar tissue process has begun. And so someone in that instance, we're going to look at them as a candidacy a little more aggressively because we're really working uphill at that point. Auto accidents are very, very damaging to the spine, much more than people think, even if there's no damage that's done to the car. There's a lot of the latest research that shows that some of the most damaging auto accidents are with a quarter portion of the car damaged or less. So those fender benders that most people think about, that they only just get bumped and they say that they're okay, the problem with that is the car doesn't crumple, so the patient absorbs all of that force. That's very damaging to the spine, and again, when the altered mechanics of the spine occur, that's when we really start to see a lot of these issues. And then we really start looking at MUA for these type of patients because they really benefit greatly from that.
The reason why I love MUA so much is because the outcomes are phenomenal. To see a person who comes in, even on day 2 of their procedure, smiling because they slept through the night. That's something that I hear a lot. They finally slept through the night without pain, or they were able to, walk that day for 10 minutes without pain, which was something that they never had before. That is phenomenal. And to be able to do it with it's just so minimally invasive is fantastic too. Obviously back surgery is extremely invasive. Scar tissue is built and formed from doing, back surgeries. And I would say our outcomes have been 98%. I only know of one patient that we did MUA on through the last several years that went on and did have to have surgery. One patient who had been in a car accident and had some serious nerve damage from the accident. And I remember she started to wake up from the anesthesia crying, and I was worried that she was in pain, but actually she was crying because it was the first time in years that she didn't feel any pain. We've had numerous where the patient has come in just ecstatic. After only day 1 or 2 of the initial MUA procedure, just thrilled with how they feel that they're able to actually get around.
MUA is performed here at an outpatient surgery center. We do it specifically at the American Surgical Center here in West Bloomfield. It's a very nice, small, quaint facility, easy to get in and out of. The staff is extremely friendly, and our patients always give rave reviews about the staff here. And so it's not a place you're going to get lost in. It's a nice, quiet environment to relax and to get well in.
Up until now, nothing has worked longer than a few days at a time, and nothing has worked 100% pain-free. But yesterday, I can honestly say it was the first day I felt no pain all day, beginning to end. So that was nice.
Football game?
Yeah, like I got to go to the football game, walk around, sat in the bleachers, didn't have to worry about that. I didn't have any pain when I was laying down. Usually I toss and turn at night trying to find a comfortable position, you know what I mean? So I didn't have that. I slept all night. I woke up like feeling rested or something like I haven't felt in a long time. So yeah, now I'm so excited. Yes, I'm like dying to know when I can start running and everything again.
I didn't get cut into, you know, and I'm not in the hospital, and I'm not taking months and months to heal and being in so much pain, you know, after a back surgery, you know. It's an amazing difference. And I gotta tell you, I was really skeptical about this whole thing because, you know, I've been through all those surgeries and everything. After my third surgery and I started having problems again, I went to a specialist down in Ann Arbor, and he just said, Richard, there's just no more we can do for you surgically. You know, and I'll never forget that day because I thought to myself, I can't believe I have to live the rest of my life this way. So after the first treatment, I went home, and I just knew I was feeling good, and I bent over to see how far I could go. And in the past, I couldn't get much past my knees. I was able to all the way go down and touch my toes, and I have not. It's been years since I've been able to do that, and that was after the first treatment. So I know it's only going to be better, really.
I can begin to tell you all the stories we had of all of the things, from golfing to playing with their grandkids to running again to going back to work full duty, things that people never thought they were going to be able to do again. You have that potential to go back to your normal life, and MUA can give that to you.
If you're suffering needlessly, don't continue down that path. Give us a call. It may just change your life.
If you have fibromyalgia, if you're suffering from chronic back or neck pain, from disc herniations, chronic migraine headaches, give us a call. MUA procedure may change your life.